The National Immunization Technical Advisory Group, or NITAG, has recommended China's Sinovac for health workers. The Food and Drug Administration had earlier said that the China-made shot was not suitable for health workers who are regularly exposed to COVID-19 patients. NITAG member Dr. Maria Consortial Lim Quizon joins us live to discuss this. Good afternoon, Dr. Quizon. How exactly did NITAG come up with this recommendation?
Well, first of all, good afternoon, Charles, and good afternoon to the viewers. How were we able to come up with this? We actually had a series of meetings, 4 meetings, in fact, among the various experts of the NITAG. And actually, I think there was a misunderstanding on the premise that the first premise that it's not suitable. All right. Okay. So the FDA said it's not suitable for health workers who are likely to be exposed because the protection that it will give them would probably be around 50% in mild cases. Okay, what was lost in translation was that it is 70% effective in preventing moderate cases and 100% effective in preventing severe cases. And this is the more important thing rather than looking at the prevention of 50%, 50% efficacy in preventing mild cases. So, it's not really overturning or saying one was wrong or one was correct. It's just that somewhere things got lost in translation.
All right, just to be clear, Doc, there is good to be had here since the most extreme cases are avoided, no? In the sense that you avoid death or extreme hospitalization at the very least. But then, given that there are 2 different recommendations now from the FDA and the NITAG on the other hand, will this now be confusing for the medical frontliners and to the public in general? And how do you intend to reconcile this?
Well, as I said, there's not really, first of all, when you talk about, when your worry is, are the health workers going to get confused? They are probably the first persons who will understand the meaning of this one. It's just that initially, the recommendation, if you call it a recommendation, was centered on that 50% efficacy regarding mild and na overshadow yung the more important thing that it will prevent severe cases.
Okay, so now the theme is that it is okay for health workers and this is the recommendation of the NITAG, but then between the NITAG and the FDA, who actually has the final say?
The final say is the IATF. You know, the NITAG is a recommendatory body. I mean, we review to the best that the science and the data can tell us what is the science telling us. We base our recommendations on that. You know, after we've crafted a resolution, then we present it to the IATF, and then it's for them to approve or not.
Right, but then according to a recent survey from Okta Research, the Chinese-made shots do have the lowest trust ratings. How do you feel this would affect the vaccination program in general?
You know, when you talk about trust ratings, there's so many factors playing. When you say trust, it's not because, you know, the vaccine per se is unreliable. It could be, I don't know, politically motivated. It's because you know, xenophobia or something, you know. So in short, I trust the vaccine.
Right, a variety of things could come into play, that is understood. But then right now, do we already have the final list of healthcare workers who are set to take the Sinovac vaccines, the vaccines that are set to arrive on Sunday, and how many are we talking about here?
Okay, we are expecting some 600,000 doses, and I want to clarify that the 600,000 doses is good for 300,000 people because 2 doses per person, right? So even before this Sinovac, you know, about 2 months ago, the NITAG has already given a list or prioritized um, who to give. And of course, no doubt about it, it's the health workers, okay? So it's the health workers in the entire Philippines. However, we were also aware that it's not likely that any single vaccine would come in that bulk. We estimate that there would be 1.5 to 1.8 million total of health workers in the whole country. And, we're not expecting that many vaccines. So we use another parameter, which is which geographic area in the Philippines is most at risk. And we know that highly urbanized areas or densely populated areas are the ones most at risk. So NCR. So we started at NCR, and we said that we will start with the COVID referral hospitals, the three biggest COVID referral hospitals in Metro Manila, and then so on down the line. I mean, if there were really enough vaccines to go around, I mean, our priority really are all the hospitals in NCR. For starters, But then there's not, as I said, there's not enough to go around. So we had to go back to the drawing board and start prioritizing again para kung saan magkasya o hindi magkasya, kung sino ang dapat mauna dito sa mga vaccine na ito.
All right, interesting times as we wait for the vaccines to finally arrive this coming Sunday. Thanks for those insights and clarifications, Dr. Quizon from the NITAG. Presidential Advisor for Entrepreneurship, Joy Concepcion, says the private sector is willing to chip in to cover the logistics costs of AstraZeneca vaccines. Concepcion told Business World Live that they are in talks with Zuellig Pharma as a possible distributor for the shots, pending the health department's approval. Last November, at least 30 members of the private sector pledged to donate 2.6 million shots from the British-Swedish firm.
In the case of AstraZeneca, since we just purchased the vaccines, we basically are in discussions right now that the private sector is willing to cover the cost of the logistics.
Some manufacturers are planning to create a third booster shots for their COVID-19 vaccines in a bid to increase immunity. Let's find out more from Bloomberg Surveillance.
So titer refers to your antibody levels. The antibodies are some of your immune responses to the vaccine. And we're used to measuring titers for other diseases. You get your titers checked for tetanus or whatever to see if you need a booster shot. But that's not the only part of your immune system. And so what I think is the missing story with the variants and some of the fear surrounding them is that these vaccines are also stimulating T cells and other cells of your immune system that are a little more resilient to some of the variant changes. And so what I would encourage everyone to look at is the real world data, to not just see if the antibody titers are falling or the neutralization titers are falling, but to see if there's actually a real world difference, because thankfully everybody's immune system is a lot better armed than just the one lab assay can detect.
We are gaining confidence as a nation and frankly as a world. Bloomberg speaking with the World Health Organization leadership from Africa just moments ago, an hour ago or so. Dr. Gronwald, do you have a building confidence in how we're moving forward? Or again, is there a real mystery?
Is there a mystery on the new variants? Well, we're starting to shine a light on the problem. And so before, I think if this was 10 years ago, we wouldn't know about any of these variants until a paper came out 2 years from now. So we are really getting much more on top of them. And maybe we could have been a little bit more proactive, but I think now, I think we're really starting to look for them. But people should be aware that now that we're starting to look for variants, we're probably going to find a lot more.
And that's the curse and the benefit of having more information question. Dr. Granval, based on the information that we've gotten out of Israel, an initial study being published showing that the vaccine was incredibly effective. I'm talking about the Pfizer-BioNTech variation, and this idea that if everything goes according to what that study shows, that really it would only take 60 to 70% of the population being inoculated to reach herd immunity. What's your take on that?
I think it's great news. I think as soon as you're offered a vaccine, you should take it, and I cannot wait to get mine. So yes, I think it's very encouraging. It's real-world data that shows that vaccination works, and we knew that. But people should also know that other things really work too, like masks work, improving indoor ventilation that works too. But until you can get vaccinated, make sure you take all those precautions.
In other news, the Agriculture Department met with pork stakeholders today to discuss proposed changes in the price ceiling. Shaila Francisco joins us live from Mandaluyong to give us more details. Shaila, good afternoon. Could you tell us what was agreed upon during this meeting?
Charles, stakeholders agreed to recommend to the Agriculture Department to remove the price ceiling and instead impose a suggested retail price of 330 to 360 pesos a kilo of pork instead. Pork producers also agreed that farm gate price should be at 220 pesos a kilo, plus or minus 5 pesos. But some sectors and even the DA expressed reservations. According to retailers, the set price is still too high and will discourage consumers from buying pork. Meanwhile, the DA Consumer Affairs Department wanted to just adjust the price ceiling to 300 to 330 pesos a kilo, the prevailing price for the past 2 weeks. Undersecretary Ernesto Gonzalez said less than 30% are complying with the current ceiling based on their monitoring. He noted that the final decision may be released next week. For now, aside from the transport subsidy given to those bringing hogs to the NCR, the DA has also relaxed requirements for insurance of hog raisers affected by the African swine fever. This includes paying the losses that resulted in government-ordered culling and raising the payable amount to 100% of the insurance cover. While this is a welcome move, hog raisers want the agency to ensure timely payment and simplified requirements. As for rice, prices of some varieties have increased by 1 to 2 pesos based on DA's monitoring. But some retailers are not passing it on to the consumers given the high prices of other commodities. Charles, the Federation of Free Farmers say the high prices may be a result of increasing world market prices and higher farm gate price as harvest nears. For now, the supply of rice is still stable. Charles?
Thanks for that update. That was Shaila Francisco reporting live from Mandaluyong. For more updates, visit News 5, the Philippine Star and Business World online. Visit our website, onenews.ph, for more in-depth analysis. And you can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Charles Lejano. We're One News.